What is Elon Musk's Neuralink, and could it potentially be a game changer in the treatment of patients with neurological injuries? Is it crazy, or is it neuromodulation at its finest? My name is Dr. Betsy Grunch, and I am a board-certified neurosurgeon. And I want to be clear that I don't know all the intricate details about the Neuralink, and everything that I'm going to explain to you guys is things I have learned by doing my own research. It's a brain-machine interface device that holds the hope of restoring motor and potentially sensory function to those that have neurological illnesses such as quadriplegia. Not only does this hold excitement in the treatment for me of spinal cord injuries, but as a family member because my mom is quadriplegic. Since she's been a quadriplegic for over 25 years, the thought of her even moving again has left our memory years ago. So let's get into it. How does it work? It's an array of small and flexible electrodes. These threads are much smaller than a human hair, with as many as over 3,000 electrodes per array. It's placed by a neurosurgical robot that can implant over 190 electrodes per minute. The neurosurgeon opens the skull and exposes the brain, and then the robot comes to implant the electrodes. It's placed into the motor cortex of the brain, or the part of the brain that controls our movement. It's inserted with micron precision to avoid the vasculature. All these electrodes are then connected to a device that's implanted in the skull, then that is controlled by a Bluetooth device. How does it know to generate movement? Here's a monkey that was implanted with the Neuralink, and he is using a joystick to help train the device. And as he does things, he's rewarded by a banana smoothie that entices him to continue to train the device. Over a period of time, the Neuralink will then understand how movements in the monkey's hand can be controlled by the device. Once it's trained, you can disconnect the joystick and the monkey controls the computer with his brain. This is likely years away from being used in healthcare, and the first patient was just implanted last week. Clinical trials are currently being enrolled, and they're specifically looking for patients that suffer from ALS or Lou Gehrig's disease, and patients with cervical spinal cord injuries that render them quadriplegic or unable to move their arms or legs. The patients that are enrolled in the clinical trials will have the device implanted and trained. And through these clinical trials, we'll be able to see if it actually works in humans. You may ask, what are the risks involved? Obviously, there are surgical risks, including infection and bleeding or malfunction of the device. Some people are worried about how this device may interpret people's thoughts, but remember, this is implanted into the motor cortex of the brain. So it's really only going to be able to capture how the brain processes movement. It won't be able to pick up the innermost thoughts, desires, or anything of that nature. My thoughts on it is that it's likely years away from us being able to fully understand it, but it's extremely exciting for the future of neuromodulation and how it may impact the treatment of patients with these illnesses. I don't know what others in the field think, but as someone that's passionate about both neuromodulation and spinal cord injury, the fact that this brain interface module may help meet that need is purely amazing. So we'll see what happens.